Hope you're doing well today. This is a PSA, public service announcement around COVID. So we know, all of us know that COVID cases are going up in the area. I mean, specifically in the Midwest and the West Coast, but we're seeing cases go up here in New Jersey, Pennsylvania, as well as New York City and New York. So I want to send this little announcement to just remind us of, what we should be doing. Listen, no one wants to keep going through this, right? We all have been going through this for months now, and everyone has COVID fatigue from wearing masks, not being able to do the activities you want to do. But listen, we're seeing cases go up in the hospital. I've seen them in the ED the last week, and it's, they are increasing. Now we're not seeing the severity of illness, but it's there, and the potential is there for people to get really sick. We are having some people in the ICU. So that being said, we're going to get through this, but this is a time where we really need to buckle down and remind ourselves what we should be doing. On behalf of myself, my wife, who's a physician, in her hospital, the cases are going up, as well as all my colleagues in the hospital and the healthcare workers. We're the ones at the front lines. We're the ones that are going to be handling this when it comes in, and the people who are sick and get really sick, we're going to be the ones there. We're going to be there regardless. But what would help it and make it so much better and help us through this time is if people just keep doing what they're supposed to be doing. Specifically, doing what we try to do to prevent transmission of any viral illness, which is continuing to wear your mask, wash your hands, don't touch your eyes or your mouth, and try to avoid being in big groups or being in closed spaces with big groups, going indoors, even going out to eat and going to restaurants right now. Really being in a closed environment, it's not the smart idea, especially with cases going up. So listen, none of us want to keep doing this, right? We've been doing it for months and everyone's exhausted, but we have to. In our society nowadays, no one understands what it's like to have endurance and persistence and patience. We live in a culture and a society today which is all about instant gratification, instant downloads, instant messages, but we don't like the thought of adversity or endurance or patience or steadfast or hanging in there through the difficult times. That's something that does not resonate with our society today. Let me bring it back. There's an example. We're going through this for what, 8 months or so. And I think back to the time of Moses when he's in the wilderness going to the promised land. Now, they had to go 40 years of trials, tribulations, difficulties, 40 years. What about World War II? The people of World War II, horrible situation, having to endure this for years and years with economic struggle and the thought of something bad happening any minute. These people endured, right? And they came out stronger because of it. That's what we need to do. So in this time, it's very easy to throw in the towel and say, I'm sick of this. I'm not going to wear my mask. But listen, if whoever's listening, don't wear your mask, don't do the right things, well, guess who it's going to fall on? Well, one, it's going to fall on you and your family because you may get sick, but it's going to fall on the healthcare workers on the front line who are going to be there. We will be there, but they're going to be the ones, right? They're going to face this head on again. And it's been, very trying for my colleagues and everyone I know in the healthcare community. So I'm asking you and I'm urging you in this time, let us dig our heels in, pull up our bootstraps. Let's be people of dignity, people of value, people of honor, people of character. People of character that we're going to say, you know what, we're going to endure. We're going to have persistence, steadfastness, and patience. And we will get through it. If we do this together and we do it as a group together, we're going to get through this. But we got to do the right things. I say this because I want everyone to be healthy. I don't want someone to come in and get sick with this illness. And I don't want anything bad to happen. Our colleagues don't want anything bad to happen. So listen, take it seriously. I'm not saying to live in fear. You don't live in fear, right? You live with confidence. But be wise. Don't be foolish. Just be wise. Do the right thing, especially now as we're going into the winter season. We also want to prevent flu. I'm just asking you all to just take care of yourselves. Be safe, all right? We love you. We care for you. All on behalf of myself and all my colleagues in the medical community, we all care about everyone, and we just want everyone to be safe and healthy. So Take care, guys. Just a little PSA, and please be safe. And we'll talk to you soon. All right. Take care now.